Hi there, Laura Dankoff here from PathToHealthAndHealing.com. Today I want to talk to you about one of my favorite herbs, and that is berberine. Berberine is an alkaloid found in many plants, notably golden seal, also in barberry and Oregon grapes, and gold thread. So it goes by various names, but basically what you want to know is berberine is got many potential health benefits. So berberine has been found in various clinical studies when it's isolated to have potential benefits in helping with things like diarrhea, blood sugar, irritable bowel, so type 2 diabetes, high blood pressure, cholesterol, and maybe even, in the studies, even Alzheimer's and cancer. So berberine, basically what it does, it activates something called AMPK, a potent enzyme that is key to maintaining energy balance in our cells and protecting their growth and function. And I first started using berberine with some of my patients, and this is just my experience, so just keep in mind anything I'm telling you is for educational information purposes only. But I started using it in patients with small intestinal bacterial overgrowth. You know, a lot of times the standard treatment did not seem to suffice, and they were going into this cycle of repeated symptoms. And this is particularly the small intestinal bacteria overgrowth of the diarrhea type. And I found that utilizing berberine was beneficial because berberine I found helps lower inflammation. It is a natural antibacterial and antifungal. And several research studies, it shows it may have actions against things like E. coli and streptococcus and pseudomonas and candida. So it has a lot of potential benefits to help support our gut microbiome. And interesting to note, it has also been shown to have other benefits. One being on blood sugar regulation, as I mentioned. There's been studies done on this and looking at berberine versus some of the blood sugaring lowering medications out there. And what they found was there was no statistically significant difference between a person taking the blood sugar medication and the berberine. The results were similar. They both helped to lower the blood sugar. Now, am I recommending that you stop your blood sugar medication for your diabetes? Absolutely not. This is something you need to consult your healthcare practitioner about. But is this something that can be an adjunct or an additive for you without all the potential side effects? They also found that it had benefits with lowering cholesterol. And in fact, one study, participants that had elevated cholesterol and triglycerides were taking 1,000 milligrams of berberine daily for 3 months. And in that study, remarkably, they saw a 25% reduction in the LDL, the bad cholesterol, a 35% reduction in triglycerides, and as well as a 29% reduction in total cholesterol, and it helped improve the HDL, the good cholesterol, without all the side effects of some well-known cholesterol-lowering medications. Berberine has also been found to help promote insulin sensitivity. So when your body does produce insulin, it looks at how well your cells are going to be able to utilize that insulin. So it increases the receptivity of those cells to that insulin that can then carry that blood sugar or glucose into the cell to be used as energy. It also has potential benefits with weight loss, polycystic ovarian syndrome, and more. So really this is kind of a powerhouse herb that I often will recommend for various reasons. Side effect wise, if you do experience side effects, which I don't see very often, but usually they're digestive. But how to take berberine, I've seen it in the literature various ways. Either 30 minutes before a meal is recommended mostly. Sometimes I've seen it recommended after a meal. But this is one easy thing to do that has so many potential benefits, but just keep in mind berberine does interact with some medications. So if you're on tetracycline, an antibiotic, or some other antibiotics, it may interact with that. Also, it can inhibit the breakdown of drugs metabolized via the CYP3A enzyme pathway. So how would you know that? Consult your health practitioner or your pharmacist, and they should be able to help you. My general recommendation, with my patients anyway, depending on what I'm using it for, is generally, and in the research studies too, is utilizing 500 milligrams 3 times a day initially and going from there. But like with any whether it's a prescription medication or an herbal, you have to be mindful of their potential benefits and risks, and always consult with your health practitioner. But one of my top go-tos is the Berberine. It just has lots and lots of health benefits. If you would like to learn more about other natural ways to improve your health or about functional medicine, visit me at www.pathtohealthandhealing.com. Take care.